It's kind of wild how much health info is out there these days, right?
Yeah.
Every article seems to contradict the last one, and you're just left there like, what am I actually supposed to believe?
Oh, yeah, absolutely. It's so hard to
Yeah.
sift through all of it and figure out what's actually reliable and, actually applies to you.
Right, exactly.
Yeah.
So today we're going to try and cut through some of that noise and really take a deep dive into understanding and overcoming substance use disorders.
Oh,
Specifically, we're looking at alcohol use disorder,
okay.
or AUD as it's often called, an opioid use disorder. And for this deep dive, we're going to be looking at the resources and insights from Stark Medical.
Great.
Yeah. So we're pulling from their materials on alcoholism recovery with telemedicine
Hmm.
and their approach to opioid addiction recovery. And of course, we'll get some insights from Dr. Brandan Stark.
Sounds good.
So our goal is really simple. We want to extract what's essential when it comes to these disorders, what they are, how they impact lives, and a really crucial piece, how telehealth is stepping up to address them.
Mm-hmm.
And ultimately, we just want to leave you with a sense of clarity and some real takeaways from all this.
I like it.
All right, so let's get started. Let's talk about alcohol use disorder.
Okay.
The Mayo Clinic describes AUD as basically this pattern where you have trouble controlling your drinking.
Yeah.
Alcohol is kind of constantly on your mind,
Mm-hmm.
and you just keep using it even when it's causing issues in your life.
Yeah, I think that's a really clear way to put it because,
Yeah.
what it's saying isn't just that people are drinking too much, right? It's that their relationship to alcohol itself has changed.
Yeah.
To the point where it's kind of this central thing in their life that they feel like they can't control.
I see.
And what's interesting here is how Stark Medical is using telehealth
Right.
to give treatment for AUD that's not only accessible, but, kind of offers people a sense of discretion
Right.
and is proven to be really effective.
Yeah.
So it's really interesting.
It's like meeting people where they are both literally
Yeah.
and figuratively in a way.
Yeah. Totally.
And that accessibility piece is huge, right?
Yeah.
And I think it's important to remember how wide-reaching the impact of AUD is. It's not just the individual who's struggling, right? It has huge impacts on their health.
Yeah, for sure.
Liver damage, heart problems, anxiety, and depression are all tied to AUD.
Totally.
And then, of course, it ripples outwards from there to their relationships, their overall well-being. It really can touch every corner of someone's life.
Oh, yeah, for sure. It
Yes.
really is a multifaceted disorder.
Right.
And the consequences extend far beyond the person who's dealing with it themselves.
Right. And speaking of that, it's worth noting the expertise behind Stark Medical's approach.
For sure.
Dr. Brandan Stark is board certified in family medicine and also, importantly, addiction medicine.
Yeah.
So, he's got this really comprehensive understanding of the complexities involved in treating these disorders.
He really did. He brought such a unique skill set to the table.
Right. So we've talked about telehealth for AUD. What does that look like practically?
Okay, well, with Stark Medical, it's actually a really comprehensive care model that they deliver remotely.
Okay.
So they offer counseling, which is, vital for really getting to the emotional and psychological factors that contribute to addiction. They also provide support for detox, which can be a very challenging and difficult time.
Yeah, withdrawal can be really, really tough.
Yeah, it can be very vulnerable and frankly scary for people.
Right.
And they guide people through that with remote monitoring and, advice and guidance from experts.
No, that remote monitoring piece sounds so important.
It really is, yeah.
And beyond that initial detox phase, their approach really focuses on personalizing strategies
Yeah.
to help individuals, pinpoint and avoid their own specific triggers
Sure.
that could lead to relapse. And they teach what are called evidence-based coping mechanisms.
Right.
Can you give us some examples of what those look like?
Oh, yeah, sure. So there could be practical techniques, drawn from CBT or cognitive behavioral therapy, where individuals are actually learning to identify and challenge their thought patterns
Right.
that are feeding those cravings. And it could involve, specific skills for navigating social situations.
Yeah.
Where, alcohol might be present and learning how to say no.
Right.
Or manage peer pressure. And another big one is incorporating mindfulness techniques,
Okay.
which are so valuable for self-awareness and managing stress in those moments when you might turn to alcohol.
Yeah.
And of course, a crucial component is medication-assisted treatment, or MAT,
Right.
which uses FDA-approved medications. That can actually significantly reduce those intense cravings.
It sounds like MAC could really be a turning point for some people.
Oh, yeah, absolutely.
And the NIH, or the National Institutes of Health, They define alcohol addiction as this chronic relapsing disorder marked by compulsive drinking, loss of control over how much someone drinks, and then those negative emotional states that kind of pop up when alcohol isn't available.
Yeah, that's a really good point because it highlights how persistent and cyclical addiction can be.
Yeah.
And how powerful a hold it can have on someone.
Right. And I think it's helpful to differentiate here.
Okay.
Alcohol addiction versus alcohol abuse.
Right.
So alcohol abuse is when those drinking habits are starting to have a real negative impact on your health,
Right.
your responsibilities at work, or, family obligations, and your social life.
Right.
So it's causing problems, but maybe not meeting the criteria for a full-blown addiction.
Right. So it's almost like a spectrum in a way.
Exactly.
Where, even if it hasn't progressed to full-blown addiction, it's still causing real problems.
And the dangers of consistently drinking heavily, I mean, they're pretty well documented at this point, right?
Yeah.
We're talking about the risk of developing a dependence, which can then lead to addiction.
Right.
But also those really serious physical health problems like liver disease, cardiovascular issues, mental health disorders.
All of that.
Yeah.
And the impact isn't limited to just, physical and mental health either.
Right.
I mean, alcohol abuse can lead to accidents.
Oh, yeah.
Impaired judgment, which can then lead to risky behavior.
Right.
Strained relationships.
Sure.
Difficulties at work.
Yeah.
I mean, it can really touch every part of someone's life in a negative way.
And I think it's really easy for people to think of alcohol as a way to relieve stress.
Yeah.
You've had a long day, you come home, you pour yourself a drink to unwind.
It's such a common perception,
But what's interesting is how alcohol actually interacts with your brain.
Yeah.
I mean, it might give you that temporary sense of relaxation, but it's actually messing with your brain chemistry.
It is.
In a way that can actually make you more prone to stress and anxiety in the long run.
Yeah.
It's a vicious cycle.
It is a vicious cycle.
Where you're drinking to relieve stress and the alcohol itself is actually contributing to the problem.
Exactly. And that initial feeling of relief is almost like a temporary illusion that can really backfire.
And you mentioned excessive alcohol use can change your brain chemistry.
It can.
Which makes it even harder to control those urges to drink and make good decisions about it.
Yeah, those neurochemical changes actually kind of reinforce that cycle of dependence.
Right.
So it's harder and harder for people to break free from that pattern without getting some support.
So for someone listening who might be concerned about their own drinking or someone they know, what are some of those key signs that might indicate there's a problem with alcohol abuse?
Well, one sign is definitely increased tolerance. So needing more alcohol to get the same effect.
Right.
Another one is withdrawal symptoms when they try to stop or even cut back.
Okay.
And one of the most telling signs is this inability to stop drinking despite negative consequences in different areas of their life. And, recognizing these signs, whether it's in yourself or someone you care about, that's really the critical first step towards getting help.
So early intervention really seems to be key.
It is. The sooner someone seeks help, the better their chances of a successful recovery.
Right.
And, they're preventing further physical and mental damage down the line.
Okay, so let's shift gears a bit.
Okay.
And talk about another really pressing issue, the opioid addiction crisis.
Yeah, for sure. This is a huge one.
It really is. And the numbers we're seeing are just devastating.
Yeah.
This continuous rise in opioid-related deaths across the U.S. And California has been hit especially hard.
Right.
And we've seen a sharp increase in recent years, largely due to fentanyl.
Yeah.
The stats from the California Department of Public Health are really alarming.
It's truly scary stuff.
In 2023 alone, there were over 7,800 opioid-related overdose deaths just in California.
Wow.
And fentanyl was involved in almost 88% of those deaths.
It's just so dangerous because the margin for error is so tiny.
Yeah.
Which makes accidental overdoses really common and really tragic.
And this isn't something that's limited to certain areas. This crisis has really impacted every part of California, from big cities to small towns.
Totally. It's a statewide issue that's really affecting every kind of community.
And Stark Medical is really stepping up to be part of the solution.
Yeah.
They've got their clinic in Chico, and then their telehealth services reach the whole state.
Right.
And their approach is really holistic, trying to tackle this complex problem from different angles. It's important to understand how this crisis unfolded.
Yeah.
Because it wasn't always about these illicitly manufactured drugs, right?
This is something that's evolved over a couple of decades.
Yeah.
And it started in part with doctors overprescribing opioid painkillers.
Right.
But then things escalated when heroin became more available.
Mm.
And now, of course, we have fentanyl, which is just everywhere.
And fentanyl is so much more potent than other opioids.
It is. It's a synthetic opioid that's 50 to 100 times stronger than morphine.
Wow.
And that's why it's so dangerous.
Right.
Even a tiny amount can be lethal. And the fact that it's often mixed into other drugs without people knowing makes the risk of overdose so much higher.
Yeah. It's terrifying because you could think you're taking one thing and it's laced with something deadly.
Yeah, and you wouldn't even know.
And looking at the data from the CDPH, the impact on young people is especially bad.
It is.
The rate of fentanyl-related deaths among Californians aged 15 to 24 has increased by over 1,000% since 2017.
Wow.
That's just heartbreaking.
It really is. And it shows how this crisis is disproportionately affecting young adults.
Yeah.
Communities of color, people experiencing homelessness.
And then we're seeing this rise in emergency room visits and overdoses because of these counterfeit pills laced with fentanyl.
And this is why public awareness and education is so important.
Right. We need to get the word out about how dangerous this is.
Absolutely.
And it's important to remember that for a lot of people, their path to opioid addiction starts with prescription opioids that were prescribed for legitimate reasons.
Yeah. Nearly 80% of people who use heroin started by misusing prescription opioids.
It really highlights how vulnerable people can be.
It does. And it's why the work that Stark Medical is doing is so crucial. They're trying to provide treatment that's accessible and stigma-free to help people get help before they start using more dangerous drugs.
So access is a huge barrier for people seeking treatment.
It is.
How is telehealth helping with that?
Well, telehealth is really an innovative solution here.
Okay.
So Stark Medical has telehealth services available all across California, which directly addresses that issue of access.
Okay.
So through these secure virtual appointments, people can get counseling, medication-assisted treatment, and follow-up care all from their own homes.
That's amazing.
It is.
And that must be helpful for people who might feel shame or stigma.
Yeah. How about
seeking treatment in person?
Or those who have practical barriers, like, lack of transportation.
Yeah, that privacy and convenience must make a big difference.
It does, and it's especially valuable for those over 2.2 million Californians who live in rural or underserved areas where they might not have access to specialized care.
Right.
And Stark Medical also offers in-person visits at their Chico clinic 1 week per month.
Okay.
So they can provide that face-to-face interaction if it's needed.
That's great.
Yeah, so they've really got it covered from all angles.
So let's talk about the specifics of Stark Medical's opioid addiction recovery treatment.
Right.
What does that comprehensive evidence-based approach involve?
So it's a multifaceted approach.
Okay.
Counseling is a big part of it. They offer both individual and group therapy sessions.
Okay.
And that therapeutic support helps patients understand the reasons behind their drug use and develop strategies for healthier behavior.
Right. So addressing those root causes is important for long-term recovery.
Oh, absolutely.
What about the physical aspects of addiction, like withdrawal?
Yeah, well, they provide detox support through remote monitoring and guidance on managing those withdrawal symptoms as safely as possible. They don't offer inpatient detox through telehealth. But they can refer patients to facilities if needed.
Right.
And they continue to support patients through telehealth during that transition.
So that continuity of care is still there?
Exactly.
Exactly.
Yeah, they maintain that connection.
What else is involved?
So a key part is working with patients to identify their triggers.
Okay.
Those situations, emotions, and behaviors that can lead to drug use.
Yeah.
Once those are identified, they focus on developing coping mechanisms.
Right.
Which are strategies for managing stress, making lifestyle changes, and finding healthy ways to deal with emotions without turning to drugs. And they also integrate mindfulness practices like meditation, deep breathing, and cognitive awareness exercises, which can help people develop greater self-control and resilience.
Really important.
It is, yeah.
And just like with AUD, MAT is a vital component here.
Absolutely.
They use FDA-approved medications to reduce cravings, and they tailor those medication plans to each person's needs. It's a very holistic, personalized approach.
It is.
Addressing both the mental and physical sides of addiction.
Yeah, and Stark Medical really emphasizes this compassionate approach. They see addiction as a chronic health condition, not a moral failing, which is so important for reducing stigma and encouraging people to get help.
Yeah, that shift in perspective is huge.
It is.
It's not a character flaw, it's a health issue.
Exactly. And that can make a world of difference for someone who's struggling.
They believe that recovery is possible for everyone,
They do.
and they want to support people throughout that whole journey.
Yeah, they want people to know that they don't have to go through this alone.
So how can someone get started with Stark Medical's telehealth primary care?
Well, the best way is to just call them directly.
Okay.
The number is 530-514-0904.
Okay, and, taking that first step can be hard,
It can.
but it really can be the most important one.
It really can.
So to wrap things up,
Okay.
I think the main takeaway here is that substance use disorders,
Yeah,
like AUD and opioid addiction, are serious health conditions,
they are.
but there are effective and accessible treatment options available.
Yeah, and services like those offered by Stark Medical through Telehealth are really breaking down those barriers and giving people the support they need.
Understanding how complex these disorders are,
Right.
and knowing that there's help out there, often in a really convenient and private way through telehealth,
Mm.
is empowering.
It is. It is.
So I hope that you've taken something from all of this.
Yeah, me too.
Maybe it's relevant to your own life, or maybe you know someone who's struggling.
Right.
And I think the big question we're left with is, how else can we address these obstacles to recovery,
Yeah.
with technology and this compassionate approach to care?
Yeah.
What other possibilities are out there? Something to think about.
It really is.
Upper.
That's all for this deep dive. Thanks for joining us.
Thanks for having me.